So as we come back together, I'm going to ask Ryan if you would come up as well. We'll have a period to ask questions. We'll first begin with commissioners and then ask members of the public and community if you have questions of Ryan or of Rob. Ryan, is your mic on? Okay, good deal. So first, commissioners, there are mics behind you. And if they are not already live, just let us know what number and we can make sure we bring it up for you. They're all live, so we're ready to go. Any questions from commissioners for Ryan or for Rob? Okay. Commissioner Windmiller.
Thanks very much for your presentations. They were fascinating. My name is Rose Windmiller, and I work at Washington University. And one of our employees, Pete Sortino, is of course on the Regional Health Commission. But I have a question for both of you, and it goes to one of the things that I've been working on, as many of the commissioners have for several years, is Medicaid expansion. What I'd like to know is, I'm not going to ask you how we get that done politically. That's the question I get all the time, and unless of course you'd like to tackle that one. Not hearing any resounding answers there. But if we are able to get Medicaid expanded, how will that affect the safety net and the work of the Missouri Health, the Commission, the foundation?
So actually I will sort of answer your first question, because we've been talking about it a lot, of how do we get Medicaid expansion to happen in Missouri. And there is some discussion of the political makeup of our state. That's not an area, electoral politics, that the foundation gets into in any sort of way. But what we are interested in is changing the conversation at a local level. So changing the conversation about health and the health of our communities and how the health of my neighbor impacts my health. And that is a strategy that we're leaning towards, of really changing the conversation around what it means to be healthy in our local areas. In terms of the impact of Medicaid expansion, one of the things that I think a lot about, that probably Rob does too, is access. And what does that do if we all of a sudden have, so if we expanded Medicaid, we'd have about 300,000 Missourians that would be newly eligible for the Medicaid program. So the first question is, how do we get all those folks enrolled? And then, do they have a place to receive care, or are we going to overwhelm the healthcare system? Now, you start thinking about where is the safety net? What are those safety net institutions that are already seeing uninsured patients? We have the FQHCs, we have county health department. In the more rural parts of the state, we have rural health clinics, family planning clinics. We already are seeing a good number of uninsured. And the lesson learned from other states that have already expanded is it doesn't kill access. That is really sort of an argument that people are making against Medicaid expansion. But in other states that have already expanded, we're not seeing 6-month waiting lists for people to get into primary care. It's just not happening. The other thing we have to think about with Medicaid expansion is the impact that's already happening. Is our hospital systems get a lot of money from the federal government to help them see uninsured patients. That money's going away. It was part of the Affordable Care Act if we're going to expand insurance coverage to all these new Americans, we can take some of that money we're spending on uninsured folks. So our hospitals are being put into this place where we don't have Medicaid expansion, and they're losing billions of dollars a year that is being pulled. It's something called DISH dollars that goes to hospitals to see uninsured patients. So access is a question, but I don't think it's much of an issue. The bigger issue is the cost.
Just a couple of things. It'd be huge for our patients, especially those in poverty. We stitch it together every day, but we stitch it together. And if folks had coverage, they would have a shot. Gateway, we've talked a little bit about this today, has big holes in it. We don't cover inpatient, for example. Now, our hospitals do a good job with the funding they have from the feds now of seeing folks, but as Ryan said, that's going away. That's very worrisome, inpatient in our region over the next 5 years. We don't cover mental health. We would love to. We just can't. And so the fact we don't have Medicaid I think that would probably be the biggest enhancement, is we would get more mental health services to those folks that need it, so they'd have a shot to live in healthier lives. And then we don't cover brand name drugs, and that's a huge miss. And folks are really struggling with the price of their meds if they're not generic, and it breaks our heart. And so it would be a huge advancement for our patients. As Ryan said, we've already, because of the money that's been pulled back, my folks in the business community might like to know this, we've already lost right around 3,000 jobs in the healthcare sector in St. Louis over the past year or two. And that's only going to get worse. We've had several of our major healthcare providers go through layoffs, and one of our major safety net providers closed. And that's only going to get worse. And we're going to see more and more places close. We almost lost our mental health hospital in the city. Our acute mental health hospital almost closed. Thankfully, BJC stepped in and picked it up, or else we would have had a real mess on our hands, the one on Del Mar and Union. We're fortunate that they're able to cover that place's losses for now because of some of the money they get, but that money's going away. So if we don't act soon, you're just going to see our healthcare system, not just our safety net, but especially our safety net, deteriorate year after year after year as we become less and less competitive to those states that have taken the expansion money.
Thank you.
Ryan, I want to ask one quick follow-up to Rose's question, not to get into the politics too much, but do you have any polling statewide on the desire of the community for expansion versus what we're getting as far as action and output from the legislature?
So, yes, and it's a tricky question because Medicaid is well liked in the state of Missouri. So when you poll on Medicaid, about 60% of Missourians like Medicaid. Now, you can't go too deep on Medicaid because people don't really understand what Medicaid is. And when you talk about expanding Medicaid and describe the population, it's a majority that support it. Part of the problem we see is that we're 5 years into the Affordable Care Act, and the politics around that law have not gone away. So it's very easy if you throw out the attack of Medicaid expansion as Obamacare, it plummets. So it's very easy and very soundbitey to take away support for Medicaid expansion just by tying it to Obamacare.
Thank you. Commissioner Blackman.
This wasn't my question, but what you just said, I want to say in a different way. In other words, if you describe what the Affordable Care Act is to people, they are in favor of it. But if you say it's from Obama, they're not in favor of it. Is that correct?
That is correct.
Thank you. The question that I have is, safety net for me, by virtue of its name, means that people have already fallen. And my question around that is that with the number of people that you see accessing safety nets, do you have any data on whether or not these people are accessing safety nets only for incident-driven care, or are they actually getting preventive care?
So our community health centers we describe, while they do have primary care physicians, they're medical homes. And so they are working on prevention. It's prevention and primary care. And safety net is kind of a tricky word, because if you go back in time, 10, 15 years, our community health centers were the place of last resort. It's where you would go when you couldn't get in anywhere else. We've gone on a really wonderful 15-year transformation journey in terms of building brand new spots, working on our quality, working on our service metrics. And so I personally use a community health center, not because I'm making a big political statement, because it's up the street for me. I get great care, the physical plant's great, the parking's easy. That's where I go. It's easy. And so more and more what we have is high quality healthcare in your neighborhood that's not safety net. It just happens to be these neighborhoods are all across the community and not just focused in West County. And we're very proud of that.
I recognize that those services are available. My question is, the people who come, those 700,000 people that you're seeing a year, are they coming for primary care or are they coming for intervention? And let me tell you why I asked that question. Because it's also tied to poverty. It's tied to the kind of jobs they have. I work on that medical unit that is partly sponsored by MFA, and I know that many of the people who come on do not have the luxury, the privilege of primary care or preventative care because they can't get off if they have a job or they don't have access. So they end up coming only if they're ill. I'm asking, is there data that addresses whether or not the people who are counted as being seen are being seen preventatively on a routine schedule to prevent illness, or are they showing up when they are sick, regardless of you having primary care physicians?
So, no, there's not hard data on that I know of. Now, I will answer this question, is that our people show up sick? Not all of them, but a lot of them. Do they come for routine checkups? Yes. Do they normally come when they're sick? Yes. Do a lot of our folks have very complex medical histories that require frequent intervention by the physicians or their team? Yes. You know, when 45% of your folks have hypertension, diabetes, or both, we have to see them frequently to keep them in check. Is that prevention or is that seeing you when you're sick? Yes. And that's why the data is kind of tricky on that, because our folks are showing up so sick, and it's part of the history. You know, sometimes they hadn't had access before. Sometimes they're living lives that are tough and making them sick. So our folks are showing up to our clinics, not all of them, but a lot sick. We treat them, we try to get them well, we get them back on the street. Sometimes we don't see them for a while, sometimes they come back, just depends on the person. Now, more and more, we're seeing them less and less in the emergency room, and we're very proud of that. Our non-emergent emergency room visits are actually down in the region. So they're using the primary care more and the emergency rooms less. That's a good equation. Now, is that everybody? No. Are there sick people that don't get in to see a doctor? Yes. Do we wish we could see everybody? Yes. You know, if we see roughly, now it's 700,000 visits, but roughly 300,000 people a year, could we see 5? Yes. There's a lot of reasons why we're not. And again, that partially gets back to the medical model only goes so far too. And I think Dr. Purnell was chatting with you about different strategies they've thought about that's additive to the medical model. Not replacing, because when you're sick you should see a doctor, but getting out into the streets with some of our stuff, getting in the schools, getting in the places where people are and talking wellness. And that's what Alive and Well is all about too. It's talking about reducing the stress or dealing with it better, and not just waiting till you're sick. So that's a big piece of the puzzle as well. So it's a very complicated answer. Are we doing prevention, or are we seeing people when they're sick? The answer is yes. And the answer is we still need to do a lot more to get a healthier population.
One last question, and I will be quiet.
Tricky question, by the way.
I'm grateful that BJC is taking over the mental health beds in the city. But simultaneously, they're also closing the county location and combining those in the city. So we'll have one less facility for mental health, even if we don't have less beds. My concern also is that when people come to the safety net or the full health care centers, whatever you want to call them, if they are in need of specialty care, if they're in need of surgery, I'm wondering what the lag time is in connecting them with the few resources that we have left. And lastly, I have a great concern that when people fall through the cracks, or when there is not enough health care, and there still isn't, that the onus for that will fall on those of you who are trying desperately to make it better, rather than on the politicians where it belongs. And I'm very concerned about that, because there's a moral accountability for taking care of citizens. And St. Louis, Missouri is failing miserably at that.
On the mental health, there's no good answer. We have a mental health crisis, not only in this city, in this country. And all I have to say is an anecdotal story. So I am the father of a son who we fostered and adopted. Happens to be an African American who's now 16, God bless my soul. But when we got him, he was 7 years old as a foster child. And he had a really crappy 7 first years of life. And he came to us with 7 mental health diagnoses. So he came to us as a foster child on Medicaid. And for months, probably 2 months, I searched for a child psychiatrist in this city that took Medicaid. There are none. I finally, through a friend, because I happened to work in healthcare, was able to find a doctor, child psychiatrist, who comes across the river once a month, has an hour-long clinic. I learned my lessons. So the first time I called, they made an appointment for 2 p.m. Apparently they give 40 people a 2 p.m. appointment. So I got there at 2 p.m. And was the last to be seen because they just put you in list of when you walk in the room. And then when we finally got in to see the doctor, he saw my son for 4 minutes, asked him what his favorite video game was, and wrote a controlled substance prescription. I was horrified. So I was very excited when we adopted him because I would be able to put him on my private insurance through the foundation. Because I thought, if I have private insurance, I can access mental health care. Got private insurance through work, put him on it, made a phone call to a local child and adolescent psychiatric through WashU. For private insurance, it was a 7-month wait for our first appointment. I'm not blaming anybody. We have a mental health crisis. We do not have access to mental health services in this city. And it's not just St. Louis, it is nationally, but it's something we have to address. And it goes back to what Bethany and Rosetta were saying about the stress and the toxic stress. We know it ties to our physical health.
Ryan and Bethany and I and the team that's out there, we feel like we've got our fingers in a lot of dikes, holes in the dikes, and they're breaking. And we plug it here, and it squirts out here, and then we plug it over here. And this is back when, the water was flooding us 10, 15 years ago. And the dam's about to break again. So yes, we're doing our best. I share your last concern. That when it breaks, and it's going to break, I keep telling people, without Medicaid expansion, here's what's going to happen. Hospitals will close. You can't pull, I thought Ryan was going to have this number, and he didn't. He took it out. But the hospitals in Missouri are going to lose $4 billion over the next 7 years. It's a lot of money. It's a lot of money across Missouri. When that money gets pulled out, you're going to see rural places close, and we've already seen a couple close. You're going to see urban areas go, and Truman's on days cash on hand, hours cash on hand right now. A couple of our other safety net providers are hanging by a thread. And you're going to see service for the mentally ill get even more constrained. You know why I know those three? Because that's where people can't pay. We'll still have our facilities out at 40 in Ballas, I promise you. Those will be the last to go. You know why? Amen, Reverend. So without, some sort of intervention soon, we're going to give out. We just will. It's predicted. You can't pull $4 billion out of a system in 7 years and expect it to be status quo. We're doing our best. In fact, we've done pretty darn good over the last decade with meager resources, but we've got a long way to go, and it's highly fragile. Highly fragile.
Other questions from commissioners?
I have a question.
Mike behind.
Thank you. Ryan, around the strategies that you've outlined related to housing and employment, do you have specific recommendations or specific strategies in that area that we can have access to?
So the Missouri Foundation for Health is starting to tiptoe into some of this, so it's really tough because we are a health foundation. But our board is having discussions about there are these factors like housing and employment that impact our health. Now, can we start funding and everything? No, but we did this fall. We tiptoed into the area of housing and started funding a little bit in housing because there's so much evidence, especially for what I would call medically frail populations, that safe and secure housing is the #1 priority to helping them maintain their health. I do have some specific strategies from other people that I could pull together for you and provide to Bethany, but they're not coming from the foundation.
Okay, that's helpful. And then I had 2 other questions really quickly. Around school policy, the school policies, I understand that changing juvie referrals is one of them. And question, are place-based health services in schools part of the policy recommendations that you suggest or making or looking at?
So that, I will say that is part of the For Sake of All, is more school-based health. So yes, I mean, we're supporting that project, and we know that having access for kids directly at school is useful and helpful and shows good results. I'm sure Rob may have something
Yeah,
to say
and not
about
only physicians, but the real important thing is we get behavioral health professionals in the schools. We don't need doctors there full-time. That's an expensive resource to drop into a relatively healthy population. But there's schools out there, I'm told, you're way out of my area of expertise, but if we was getting in this alive and well, they're telling me there's schools without counselors? Really? How's that even possible? How can we have schools with the population that's going through, the kids are going through what they're going through, and we don't even have counselors in them? I mean, I can predict they will be sick with a good degree of scientific certainty right now, that if you don't put counselors on the school, they're going to be sick, period. Now, I'm sure someone else can predict I'm sure my friends in the police and justice community can predict what's going to happen to them relative to that system. My folks in education can predict what's going to happen to their educational outcomes. I'm telling you they're going to be sick if we don't get counselors in those schools. And the science is clear on that.
Any other questions from commissioners?
Just very quickly, and then so we got time for audience. You mentioned the $4 billion being pulled out of the system, and that I suspect does not include things like the cost shifting going on to other payers to pick up the cost of the remaining uninsured.
Right.
I suspect it does not include the cost of the inefficiency of emergency room visits versus primary care, community health visits. So you have this kind of rampant inefficiency, which is why it is so incredibly baffling that Medicaid expansion is so difficult. And I understand the politics, but they're really irrelevant here. Not only is it just wrong for purposes of denying health care, but it's the wrong policy decision. It's the wrong governmental decision. That money is going somewhere. It's why the business community and the labor community and the community activist groups have all, I think, together said pass this without impact or effect so far. But it's because of that kind of rampant dynamic of all of those dollars in addition to the horrid health outcomes that come as a result of that. So I wanted to confirm that those numbers don't include that, so the number's really bigger than $4 billion. And secondly, to make the point that this is not a matter of disagreement in this region among stakeholders. Right?
Right. Obviously, it's a matter of some disagreement in the region. I mean, Ryan can host a forum on Medicaid expansion, and we get folks coming in against it, again, because it got so toxic politically. But, as you put the dollars and cents up there and look at what other states are able to do with it, Kentucky, for example, is a similar state that's experiencing improvements in health, improvements in access, improvements in the economy, all from doing this. Our hope, when you ask me what will it take, our hope is on Medicaid expansion that, as these states have more and more success, and they are, that the 22 outlier states, I guess it's 21 now, Montana's just coming in, those radicals up in Montana, as more and more states come in and have success, we'll be more and more out there as an isolated example of, and we won't be able to hold the fort. So But the answer is yes and yes and yes. And we do appreciate the business community in particular. The St. Louis Regional Chamber and most every chamber around the state has come in strongly for Medicaid expansion, and that's been very encouraging.
But I will go back to what Reverend Blackburn said. I travel the state. I have been to towns you've never heard of speaking about health. There is a strong component of this Medicaid expansion that is racism. I've heard multiple times, there are people in the state that come up and talk to me after a presentation that do not believe that this black man is going to leave the White House. He is going to stay. And they're scared to death. And I hear it. We do not think Medicaid expansion will happen until 2017 because there is this irrational fear, and people really believe this. I hear it all the time. So there is such a strong, we have the business community in favor of Medicaid expansion. We have the health advocates. We have the health providers. So you start, what are the things that are making Medicaid expansion not happen? Race is a huge component of this.
I want to, as we transition to any questions from the audience, I wanted to just be really specific about a couple of things. Because we will not have a health working group, we want to make sure that our working groups are informed as they consider policy recommendations with what you have today. So I want to, before you leave, specifically ask a question. I hear behavioral health professionals in schools as something perhaps for some discussion in the educational inequity and child well-being working group to be taken up as a potential policy recommendation for consideration within the working group. I hear Medicaid expansion being spoken of for its economic development, economic impact on the region, and its connection for people have to being healthy to work as an economic mobility issue that perhaps Commissioner Pulliam and Commissioner Sly, I was about to say Carr, but I knew I was wrong. Sly will want to take up in economic inequity. And one of the other kind of cross-cutting things that we've talked about is transportation. And so I wanted to just ask, when you talk about access, whether there's something related to transportation that we should also consider here when we're talking about access. Where are these, where are the points of access and whether they match? Is that something we should think about? And whether there are any other policy recommendations that our groups on educational inequity, child well-being, economic inequity and opportunity, or those that are related to safety, community police relations should be taken up as well.
So I'll comment on the transportation thing. So the foundation's been around since 2002. We've held community forums throughout the state, listening sessions. The top three things we always hear about healthcare are oral health, mental health, and transportation. Transportation related to healthcare access is huge. It's huge both in the rural areas and the urban areas. We don't have the strongest public transportation system. I say that in seriousness, in the country. It's fairly weak, and in the last year, it's interesting because I've been asked to speak around the country on the intersection of health and transportation, because we have, the ACA the Affordable Care Act is pushing us in the direction of hospital systems taking some responsibility for people staying healthy, and part of how they do that is making sure people have access to transportation to get to follow-up appointments and primary care. So there is an intersection of transportation and health going on right now. Now the good news is we just pulled together some folks from both sectors. We had a pre-planning workshop last week, 2 weeks ago, and there will be a summit in Missouri in October that is exactly that, the intersection of health and transportation. So I can get you more details on that.
So yes, I agree with Ryan on the transportation. A couple other things. We've talked about trauma and stress and its impact. That cuts across all groups, I would think. So for example, in your educational group, it's not just behavioral health consultants, but it's, and again, this is a symptom. When you lead the nation in expelling African American children, they're not going to be healthy. Because they're going to go, they're not getting the support infrastructure, and not only that, that's not a very trauma-informed response, because you're not thinking about what occurred with the kid. And you're not meeting with where they are. You're just sending them out somewhere to be at home with 5 hours a week of instruction, and they're supposed to catch up. I can predict, again, for as head of the Regional Health Commission, the kid's going to be sick when they get older, with some good degree of scientific probability. We got to do better than that. And so thinking through what's going on in the lives of our folks when they show up to our places, whether it be at Washington University School of Medicine for treatment, or whether it be one of my health centers, or whether it be in our schools, whether it be in our courts, wherever. What happened to the person when they're walking to the door and meeting them there, and meeting your customers where they're at, and working through what they need, and not just turning them out. That cuts across all your work groups. And that's what Alive and Well is all about, is understanding what our folks are really going through in terms of trauma and stress, and then responding appropriately as systems as well as just as human beings. I think if we think through that as work groups, and again, Bethany's like the host of this whole thing region-wide, so she can help you with this, we're going to be a lot better off in the long run. I promise you, from a health standpoint, and I bet the other experts that have been up here to agree with me in the other areas of their expertise as well.
Good deal. Any questions from the community? Yes. Just,
Has anyone looked at the connection between our prison, jail, workhouse, community health care system, connecting the dots in terms of massive disease factor and impacts on recidivism?
Yes. We actually worked with the county health department with a project we had looking at connecting people from the jails to our primary care sites. What we found, it was incredibly challenging to get people to show up from the jail setting into our primary care homes, our medical homes. It was just harder than we thought, and we could do a much better job of that. St. Louis County actually runs a very large medical clinic inside of the jail. So for example, if you get jailed, you get a sexually transmitted infection screen, STI screen. And they do mental health counseling screens. And they see 20 to 25,000 medical visits out of the jail. And we're able to catch a lot of the public health challenges. Again, not perfect, but pretty good. So we're able to use that because we actually have, excuse the phrase, a captured population there in the jail where we can help deliver health care. And that's a fairly effective model. In fact, the chair of our Provider Services Board, Fred Rotnick, runs that program. And it's one of the models around the country. Now, as budgets get tight, will that be something that, is something that continues? And, that's a question that we have. Where do we place our priorities? And will it be in maintaining our health of our community, and particularly those most in need, or will we shift it into something else? And again, we're fighting an uphill battle here in the state with the narrative. We're here to tell you it's a good investment, but we'll see how that plays out.
well, thank you very much. One more question here. Yes, sir.
I was wondering if the commission is considering the Washington University report on gun violence, a public health crisis. As far as health goes, is the commission going to incorporate some, it's a very long, I think they're going on for another 5 years, but is the commission considering that report as far as health?
I hear a yes. So it's being discussed in the Educational Equity and Child Wellbeing Work Group. So, yes, sir. That being said, we now will make a transition into some administrative work. We thank Ryan and Rob for their presentations. And more than anything else, for their work. We note, Ryan and Rob, that your presentations were indeed accessible, understandable, and useful. So we thank you very much for your time of sharing with us. At this time, our Managing Director, Bethany Johnson-Javois, will come forward to guide us in some commission planning and administrative work.
Thank you. Thank you to all that presented. I'm at home in healthcare, so I appreciate tonight's presentations in particular. I wanted to just, first, one housekeeping item. You are invited to a mini celebration of both birthdays of Rich McClure and Becky James Hatter. Per Rich's wife, there's birthday cake somewhere afloating, and in the back, they're pointing to it right there. So please, we want you to share, and I must be honest, because we're unflinching and we tell the truth. Rich felt really guilty about birthday cake after a whole hour about health, and so he thought he'd share with all of us tonight. Thank you, Rich. Thank you so much. And Becky as well. Okay, that was the most important part, probably, of my check-in with community. Now, the second part of the Commission Planning and Administration part of the agenda tonight, we're going to call on 3 of our working groups to provide report out to commissioners and to community as well. The first who are going to be coming are Commissioners Tracy Blackman and T.R. Carr to give an update about the status of movement within municipal courts and SB 5. This will be a verbal update. Following that, you can look to your screen as we will be receiving 2 updates, one from our Child Wellbeing and Education Equity update and discussion, and then finally one call to action will be presented to the Commission tonight and to the community tonight from the Economic Inequity and Opportunity Working Group. So please, if you would, Commissioners, come in that order to provide your report. Thank you.
We're here to give you a brief update on it's been a somewhat moving process in the legislature dealing with Senate Bill 5 as it cleared the Senate, moved to the House substitute bill, moved back, and eventually cleared both the House and the Senate. I'll just talk about some of the provisions of the bill that has been passed and it's heading to the governor's office for signature. And I want to thank the staff for providing me with this brief summary. It's been quite a process. One thing we would note, and something that we had discussed, is lowering the cap on municipal revenues, and that was a provision of the Senate bill. It reduces it to 20% in outstate Missouri, 12.5% in St. Louis County. We're wondering about the calculus that was used to arrive at 12.5%. But we'll leave that to the wisdom of the members of the House and the Senate. But what's really important is that Senate Bill 5 did define clear terms for revenue sources. It did define clear enforcement mechanisms and reporting mechanisms. Those are absent from the previous Max Creek law. Remember, Max Creek was an entity near the Lake of the Ozarks that no longer exists. And that was the impetus for passing the initial legislation at 30%. So there has been a significant drop in the amount of revenue that municipalities can receive from minor traffic violations. The impact of that we'll have to wait and see. Another is that the Senate Bill 5, and this is an important thing that we had been talking about, involves developing alternatives for failure to appear charges. This is an issue that we have discussed in terms of arrest warrants in municipal courts, that arrest warrants for failure to appear have been issued for individuals, and it results in sort of a round robin between municipalities, and that provision exists. And so we'll look at how that actually is implemented in the coming months. Another important division, the element that we had talked about in our working group, dealt with allowing defendants to present evidence of their financial condition prior to fine assessment. And what this does, it directs the Missouri Supreme Court to develop models for determining indigency, and the Supreme Court will also, and the courts will develop methods for payment. So that one issue that has been on the agenda that we have been talking about in our group is alternative community service, and those guidelines will be established.
Another element deals with creating a list of procedural rights to applicants that applies to all municipal courts. One thing that we had talked about is individuals showing up before a municipal court sometimes are unaware, number one, of how the process works. Number two, what are their rights and what will happen to them in that court. This list of procedural things has been developed. One important element, it requires that an option for electronic payment of fines be available for minor traffic violations. A number of other limitations on municipal courts. Another issue that we have that's kind of moved, it deals with citizen law enforcement relations, deals with the issue of requiring municipal police departments in St. Louis County to be accredited either by CALEA, the Commission on Accreditation for Law Enforcement Agencies, or by the Missouri Police Chiefs Association. So that's a significant change for law enforcement in St. Louis County. It also requires, this kind of goes hand in hand with the requirements for accreditation, that municipalities adopt written policies for use of force, and they adopt written policies for collecting and reporting all crime and police stop data. So that all goes hand in hand with the element, the requirement for accrediting municipal police departments. There are several provisions of Senate Bill 5 that have gone beyond things that we have talked about, and these are some important elements. I can't touch on all of them, but some of them are kind of important. One is that the municipalities must adopt a balanced budget. More significantly than adopting a budget is a requirement that municipalities have an audit, an annual audit. Most people are not aware that municipalities were not required to have an annual audit, but they must have an audit and by a certified public accountant. And this information must be published on an annual basis. They also must have adequate insurance, written policies dealing with safe operation of emergency vehicles, and written general orders for the operation of their police department. Those are key provisions, which are elements that we have talked about a little bit in our working group, but I know it's an element that's been involved in the citizen law enforcement working group as well. Other elements include refuse and recycling services. But an important element that's really important is that it directs the Missouri Supreme Court to develop rules to resolve conflicts of interest among municipal prosecutors, defense attorneys, and judges. So we'll we'll watch for that and look at those rules and procedures as they flow out of the Missouri State Supreme Court. There are a number of issues that were untouched by Senate Bill 5, because Senate Bill 5 is not an omnibus bill that touches everything that we can deal with, but there are a number of elements that remain to be addressed. I'm just looking at some of these. One element that it did not address is sharing information on the personnel records of individuals as you move from police department to police department. So that is an unresolved issue. Another area that we have not dealt with is the issue of civilian oversight of municipal police departments. So those are issues that remain on the agenda, but significant progress has been made. So, but again, thank the staff for providing with this update, and I would direct all of us to find the latest version of Senate Bill 5 and spend some time looking at it. One thing to keep in mind is I did find Senate Bill 5. All elements of Senate Bill 5 are severable from all other elements of Senate Bill 5, so that if one provision of the Senate bill is challenged and declared to be unconstitutional, the remainder stays in effect. In some cases, they'll stipulate that if one element is declared unconstitutional, the whole bill is unconstitutional. But as I read the bill, it seems to indicate that all elements, all provisions are severable from all other elements. So a constitutional challenge in one area does not affect the constitutionality of other areas of the bill. So it looks like the bill is going to be around for quite some time to come, and it looks like it'll have a profound impact on the operation of municipal courts.
Thank you, TR. Before we see if there are any questions for you from members of the commission, I want to commend Reverend Blackman and TR Carr for their co-chairing the Municipal Court Working Group. They were very thoughtful about the calls to action The legislature responded to many of those calls to action. I will point out as a matter of comment here, Starsky and I met with legislative leadership before this session started and talked about this as a top priority for the commission, realizing that it was developing. The community came around that priority in a broadly based sectors of the community. Then Starsky and I were in Jefferson City 3 weeks ago or so, and met again with legislative leadership. They were responsive to the concerns coming out of the municipal court working group, had continuing dialogue with us about things that would work or not work, and so this broadly based coalition, along with great leadership from the General Assembly, we believe resulted in this bill responding to many of your calls to action. Is now on the governor's desk. We believe the governor will sign the bill. He gave a very strong speech to the Missouri Bar Association that contained a number of the elements that ultimately ended up in the bill. So thank you for your leadership here, and we thank and we issued a statement commending the legislative leadership and others for being responsive. Are there questions from members of the commission?
All right, thank you.
Good evening, commissioners and community. Thank you. Sorry, my back is to you. But we've just had a wonderful hour and a half presentation, which really, in many ways, or probably in every way, better explains or helps explain what I'm presenting tonight as the co-chair of Child Wellbeing and Education Equity. So tonight I do not bring to you a set of recommendations, but I think a pretty comprehensive update about where we are. I do want to also tell you that everything that I'll be presenting tonight has been under the advice and counsel and instruction of the researchers and the individuals in this community that really are at the heart of this work. But the first thing that I just want to bring to your attention is our work group. I think we've had 4, maybe 5 meetings already, and through that process have landed in what I would call some key understandings, some of which you heard tonight, but walking it through in a little bit of a different way. So the first thing is the term child well-being is perplexing even to those that work in this to find a good definition from which to work. And our work group has proposed and has been working with the idea that child well-being is a goal to ensure that children ages 5 to 25, the age range is very important in this process, to thrive in their daily lives. I just want to stop on the word thrive for a moment because at first glance it seems pretty uninteresting. It probably is like, what's the big deal? The big deal is the fact that there are so many children in our region that are simply existing. That's the big deal. And so our job and our work group, and obviously as the commission, is to work in a space not of existence but of thriving. And so as we tackled what is child well-being other than that goal, we really had to dig hard. And I hope that the simplicity that I'm bringing you today doesn't suggest that we're simple-minded about it, but simplicity in the sense of clarity, that we're really starting to get what it means. And so I must talk about at least one work group member, Dr. Ramesh Raghavan from Washington University, who has been so spectacular in this. But he explained to us, and I'm going to suggest, I'm not going to ask you to stand up and make this move with me, but I am going to ask you to at least think about it. That when you think about child well-being, there's 2 things that are going on. One is the absence of something and the presence of something. And when you think about what must be absent in a child's life in order for them to be healthy and to thrive, these are examples. This is not the full list of things that must be absent. Racism, segregation, poverty and everything that poverty brings. You We heard about health and lack of access and et cetera. Violence, compromised housing. There must be the absence of interpersonal distress and disorders that you find in many mental health diagnoses. And there also must be the absence of really serious, concerning interpersonal relationship issues such as bullying. So I want you to think about it, because this is the important thing to remember. We think we know that, but I want you to just imagine that you're using one hand, and you have to push down. Literally take your hand and just push as hard as we possibly can to depress this. And at the exact same time, we must be using the other hand to push up as far as we can to lift children, to surround them with the caring adults, and I'm going to get a little bit more detailed than that, to give them quality education, adequate food, nutritious food, physical activity, play, safe, wonderful places to play, and secure friendships. And so I want you to think like this. While you're pushing down, you are pushing up. This is the oddest movement ever. We cannot find, we've looked for examples, what works like that. But what works like that is child well-being. The second thing, there's three big takeaways that we learned in this process. That child well-being doesn't work like a seesaw. So if you simply, and just think about that list, if you simply just push down and depress racism and poverty and segregation, it does not mean this other side automatically goes up. That's where the force of pushing up must happen. So they've said to us, yes, of course, we want better housing, and we want less poverty, and we want all of the things that we just listed. But that in and of itself does not guarantee child well-being. Child well-being is pushing down and pushing up. It is not a seesaw. This really helped our work group understand how some children in our region can be growing up with the absence of many of the things we're talking about. They're not growing up among racism and poverty and lack of health care and a number of different things, yet they're not okay. And we see that in children that are living in different parts of our region that are dealing with drug addiction and a number of other things. However, some of the things that are present are really some of the things that need to be absent are very absent, yet they're still not okay. Which helps us as a commission understand, and hopefully this community, when we said for all children, we really meant for all children. But there's a group in many places in our community where when the absence and the presence become reversed, and you've just heard it over and over tonight, this idea of toxic stress, where the issues should be absent in a child's life, racism and segregation and poverty, those should be absent. They're present. And what should be present is absent. And the combination of reversing those is what creates the toxic stress. And I think the last takeaway, and I think to Commissioner Rasheen Aldridge, this is something very, very important for all of us to know, remember, and do something about, is if you really want to know how children and teens and young adults are doing, you have to ask them. They are the ones that have to bring their voice to the table, and we are the adults that have to ask them. So as you see us going forward, you are going to see what I would say these four kind of conceptual understandings really play out in our work. So the next two slides I want to show you is just the work, where it is, and it's pretty enormous, what is happening in our work groups. But the very first one that I want to point out seems obvious, but tonight the testimony really gave us examples about child well-being and the idea that children need to be surrounded by strong, caring, and responsive adults. Their parents, their teachers, their mentors, counselors were brought up tonight. The list could go on. And that seems so obvious. But there is a new body of work coming out of Harvard, out of the Center of the Developing Child. We have the video that really does explain that idea as it relates to toxic stress. And we are going to be working with them to understand it. So you say, well, we know that. We know that children must have strong adults in their lives to grow up to be strong children. Yes, until you listen to the data tonight that says we've got so many parents that can't get Medicaid, they can't get the help they need. Unless you start talking to the USDA and asking them about feeding programs, and it's for children and not adults. And the policies that may work for children, but absolutely do not work and support the adults in their lives. And we would offer up, if the adults in children's lives are not healthy, it is really, really almost impossible for the children to grow up and be healthy themselves. So whereas this looks obvious, the truth of the matter is it's really not practiced. It's common sense, but not common practice to take care of the adults in children's lives. Food security. I know that last time I could not be here, and you graciously supported a call to action on what we are now calling an urgent call. I want to be clear, it was not the ultimate call. It was the urgent for summer because of the issues related to food in our region. Around 23%, that relates to about 250,000 people, that's children and adults, are very concerned. The pediatricians are very concerned about food this summer. But since then, we've had another meeting. I want to share with you that there is leadership right now from the United Way, from Scott Schnook and the Schnook family on a I would call a research investigative process to understand what is the real research around food insecurity in this region. So we are walking kind of side by side as we're trying to find out the mechanics of everything. They're working on the research. Their research is to be completed in September. We're asking for them everything they get to send to us so that we can have recommendations for the commission. But I think an interesting thing that they've set out as their goal is not to simply feed those that are hungry, but to end hunger. And I think that's a very different goal than what's been talked about in the past. And I can see 3 of the work group members. So Maddie, thank you, from the county, who has been very generous to help us on that. Monsanto has shown interest, ADM has shown interest, the state of Missouri Department of Corrections and their farms have shown interest. We have a number of groups that are here to support that. Parent education and engagement. We have already gone through the process of that. Our colleague Allison from Parents as Teachers and others have been a part of this work. And I'm just going to go down the list of things. Violence, brought up gun violence, both in the home and the neighborhood, is something that we're working on. Family structure, family, child, mental health services, you've heard all of this. So when you look at the 3 categories, if we've put a check, that means we have completed it. I mean, we are way down the path on this, and we've seen our space as we need community input. Second thing is we need the experts in the final research review to back up, to put us in a place so that we can make recommendations. And finally, do we have the evidence-based recommendations finalized. So if you see an X, it means we are not there yet, but it doesn't mean we haven't done anything yet. There may be meetings in place, research is being gathered, but these are the areas on child well-being. Obviously, there is deep connection and interconnectivity on a number of issues. So the chart looks siloed, but the work is anything but siloed, and certainly will get connected as we move forward. And then the last one is education equity. And so our definition of education equity is a measure of achievement, fairness, and opportunity in education. And this is a very long list of issues that we're undertaking. And again, with checks and X's, we are telling you the status of this work, but if I could read it for the benefit of everyone in this room: early childhood education, human capital in education, school to prison pipeline. John is in the room, who's been on many of our meetings, keeping that in front of us. Commissioner Gore, thank you for elevating it the last time. The health conversation came up again today on the school prison pipeline. The Missouri accreditation system, social service coordination in this region, also with schools, funding for public education, Missouri transfer bill, I'm going to come right back to that, college access and affordability, we're very close to recommendations, school district models, and school culture. These are all in some form of motion that we are really trying to get the input on, the research around, and the recommendations ready. I do want to speak to the Missouri transfer bill. I think if you haven't heard, the transfer bill is on the governor's desk. We as a work group and you as the commission approved our recommendations to send to Jefferson City. And we had 5 recommendations I would like to remind you of. Number 1 was to prioritize accredited schools in the same district, which meant if it is an unaccredited district, they could move to an accredited school, and the DESE was going to have to go through a process of the accreditation for school. The second thing was we asked them to adopt the VIC rate. The third thing was to ensure members of an assistance team, if they were assigned to the accreditation to an unaccredited district, that they would have to have prior experience, cultural competencies, and the like to work in those schools, and that the language would not say they must follow their recommendations, but rather they may, depending on what those recommendations were. The fourth one was that they must accept schools, which means the receiving school districts must accept the students. And you'll remember the conversation that we had about the Safe Schools violation. That would be the only reason why you could reject a student, not because of just other discipline referrals that allowed him to stay in his home district. And then the last one was mandate accountability. If a district was going to charge a receiving district was going to charge money outside of the VIC rate, you must be held accountable. So it's Monday. The bill is on the governor's desk. I have, for the most part, 100 and something pages. Our team is working through it. I read the first 35 pages before I came here today. I don't know how many telephone calls we've been on. We are going to create a process way of working through this as quickly as we possibly can so that we can come back with some type of thoughtful recommendation about where we stand. But let me be clear, based on what we know right now, is the VIC rate was not adopted. And we know that the accountability is compromised. In reading parts of it today, it looks like it may be a graduated, but I don't want to speak out of school on this, but our recommendations are fully compromised. So it doesn't mean we have a recommendation, it just means we've got a lot of hard work to do very quickly to come back to you, because it does not meet, right now, the threshold of our recommendation. And we are going to owe you that sooner rather than later. I think that that wraps up the final report, and certainly we'll try to answer to the best of my ability all your questions.
Are there questions or comments from members of the commission?
Yes, ma'am. Commissioner Black. Yep. Why 25? Yeah, I think a couple of things on that was mostly individuals and experts in the space were looking at that number. I think according to the federal government, it's very close, if not exactly on, of where they consider adulthood. And we're looking very closely at some of the data between the 18 and the 25 was a really critical part for us to make sure that we were addressing the young adults, that we did not want to leave them out. Could you make an argument for 26, 27? I will tell you that one thing in the Harvard group as suggested, which was kind of new for us, was the idea of, as much as we talk about getting to young people early on, and there is no debate about that, but some of the executive skills are still very much building in the 25 to 30 range. But 25 was the number.
Any other questions? Thank you, Becky, for your thoughtful and thorough work. Was for Commissioner Pulliam and Commissioner Sly, please.
We put up the first slide, please. This work group is entitled Economic Inequity and Opportunity. It's an extremely broad topic. I know Becky has a broad topic, but I think we beat her here. Can you put up the members of the work group? Because it's a broad topic, we have 23 members of our work group. We got a late start, so we've only had 3 work group meetings, but I'm not going to go through all the names and the titles, but you can see that it's a very, very wide variety of people and disciplines that are represented. There are academics, there are bankers, there's Mike McMillan of the Urban League, on and on. Lisa Lyle, the head of MICDS, who's been very, very helpful. Ginger Imster, who used to be with City Academy, and is now heading Arch Grants. So a wide variety of input that's been extremely helpful in developing a path here. Go ahead. Thanks, Starsky. In this work group, what we've done is established a criteria for model evaluation. And we make sure that everything we look at, every model that we talk about cross-cutting criteria to make sure that every one of these boxes are checked. So we're looking at, is this model urgent and important? Is it unflinching? Does it have traction? Is it organic? Is it pushed by trust builders in the full community? Does it address and explore the root causes first? Is it inclusive? Is it doable? And is it transformative? And one of the key issues of our work group is improving economic mobility, which is the ability of a generation to exceed where they came from, the economic position that they came from, and move up the ladder. For those of you that might remember, we had an early, commission meeting where we were ranked 47th, the St. Louis region, and 42nd in economic mobility, and wouldn't it be nice to at least move in the top 10? So economic mobility is very important, so we have specific criteria here that any model we look at be dual generational addressing both parents and children, that it attempts to build wealth or address wealth stripping, and that it recognizes that place matters. So what we're going to bring to you today is a call to action for a specific model we call child development accounts. We've done extensive research here. Felicia and I have both talked to academics, several meetings with Margaret Clancy from Washington University. We've talked, of course, Jason Purnell and Keon Gilbert at St. Louis University, and a number of other people. And we believe we have a model here, at least a concept of a model that we think will work. Child development accounts are investment products that allow parents to build savings toward a child's educational expenses after high school graduation. Early research indicates that holding a child development account and having assets for college may matter more than the saving behavior of parents. And what we mean by that is if a child is born, automatically has a child development account, basically a 529 account, that's automatically has enrolled, whether it's $50 or $500 or $1,000, that parent at that moment says, my child's going to college. I haven't been to college, my child's going to college, and starts thinking that way. And the behavior changes. And every birthday party that that child has, the aunts, the uncles, the cousins, please put $20 or $30 in my son's child development account because he's going to college. Don't bother with the baseball or the basketball, he can get that somewhere else. And then when that child's old enough to learn and understand that he's expected to go to college, and that there'll be a huge gap between what that child development account has in it because of investment returns and the actual cost of college, that parent has to say to that son or daughter, you have to get your grades up because you're going to college. We have a college development account for you, but you have to get your grades up to make up that gap with a scholarship. So it's a behavioral change, not just a savings account. So it also symbolizes that for some mothers, that someone outside the family cares about their child's future. So what we're proposing here today is a concept. There's still a lot to be worked out here, whether it's $50 or $500 or $1,000, whether it's all public or private or a public-private partnership, that still has to be worked out. But the call to action is to expand the current scope of the MOST 529 matching grant program in Missouri, so it's used as a platform for progressive universal child development accounts that are statewide, they're automatic, and progressive. The accountable body would be the Missouri State Treasurer and other capacity building organizations, and as I say, this could be public and private funding. The examples that the pilots that are out there today are from the state of Oklahoma, the state of Maine, and there are also a lot of local examples with the Normandy School District and the KIPP charter schools, and those are privately funded through nonprofits and individuals. So we think this is a concept that has legs, and we would ask your approval to move forward. Any questions before we?
Thank you. Rose?
Yeah, Rose?
Just a quick question, Pat and Felicia. I heard you mention the existing MOST program, but Pat, I thought you said it was a matching program, and I'm not aware that it is a matching program.
It's not, but it would be nice to have one.
Okay, so that's part of the recommendation?
Yes.
Just
To
wanted-
expand the MOST program to become a matching program.
Thank you.
Yes, Scott?
Would these accounts be set up for all children or economic classifications or?
Well, that was a subject of discussion at our last work group, and that's why we put the word progressive in here. To be very, very candid, my grandchildren don't need this account, but others do. And it has to be set up that way, and there's a lot of I's to be dotted and T's to be crossed before we get there, but
Okay.
I think it needs to be automatic and it needs to be progressive and be targeted to the underserved.
Good questions. Others, questions from commissioners?
I had one. Because this would be automatic for all children, I wonder whether there'd be budget implications and whether on accountable bodies, the Missouri General Assembly should be added as well.
That's probably a good idea. And that's why we didn't set a benchmark for the initial investment, because we haven't run the economic analysis to see exactly what would happen. But with the public-private partnerships, that includes the legislature, but we're here in Missouri, so we probably need to make that as specific as we possibly can so that they can recognize that we're asking them to participate in this process. And another thing that I wanted to add around this work is in many of the states, Wisconsin specifically, regard child development counts as a workforce development program. So it's cutting across many of the areas of concern where we're looking to move economic mobility.
I would just want to add one thing to that. There's a financial literacy aspect to this too, that this parent, this mother, gets a monthly statement that details what that account is doing, looks at the inputs to that account. They understand how the account grows, you know, the time value of money and so on and so forth. So there's that aspect of this that I think is very important.
And another thing that we learned from the Center of Social Innovation in terms of the financial literacy is that when every child has an account, it provides an opportunity to bring financial literacy into across education in curriculum. So while we're having accounts in Normandy and we've got this traction in City of St. Louis, and then we've got a philanthropist that's funding KIP, what we're doing unintentionally without adopting universal opt-out accounts is creating disparity in our community for children that aren't lucky enough to be a part of the traction that's happening. And so, but, you know, part of this is the changing of behavior, investing in children, using it as a stimulus for workforce development, but making sure that we address an unintentional disparity.
Yeah, that's one of the reasons why I noted. The way this reads, it says capacity building organizations through public-private partnerships. So there's direct accountability for execution in the executive office of the treasurer, but there's no accountability as stated here for the legislature to actually fund. So that's one of the reasons why I noted it. Is
Commissioner Black?
Thank you. Yes.
I'm curious, would this be in addition to what is being launched in the city now?
What are you speaking of?
Tashara is already launching child development accounts in the city with $50, and I know the amount is not set here. I'm asking, would these be in addition to that in the city, or is this going to be rolled into one program, or have you thought about that?
We haven't thought about that because the traction that she has in that program, we're well aware of it, and we feel positive that it's going to fund it. There's a lot of interest in getting that done, and so we want to make sure that all children are covered. And those are based on geographic areas as well as individual interest for funding it. So we're covering all of the other children. Now, what if it doesn't happen?
So are you
that we
saying
include
that
the kids in the city?
I'm sorry, I just want to be clear. Are you saying that those in the city would not end up with 2 accounts?
No, they
but
would not. They
you
would
would
not
get-
have 2 accounts.
In fact, I think what's going on in the city is a great example of a pilot of how this could work, but based on what we know. Okay, if one of the co-chairs would make a motion and the other would second it, then this is a call to action that does require commission vote. So,
Do we need to amend the wording?
yes, so
Accountable
thank
body.
you. With the agreement that we add the Missouri General Assembly, and I would say the governor who proposes a budget to the accountable bodies.
And so then we would be grateful to the commission if you would approve with a motion and a second this call to action, given the amendments, including the legislature and the governor's office as accountable bodies.
So I'll take that as a motion, and Commissioner Sly, Commissioner
Second?
James Hatter adds a second. So any further discussion? So the commissioners, all those in favor, please say aye. Aye. And those opposed? Okay, it's passed. Thank you very much for your hard work, all of you. Thank you. And now to our Managing Director's report. Managing Director Johnson Jevois.
Just want to recognize the co-chairs tonight. You may have noticed that Commissioner James Hatter was standing in addition to that recommendation, because we do understand in our community that these issues, although we need to slice them in a way that makes us productive, really do have realms with which they share priorities, and they share the same type of action that needs to be taken. So we thank you, Becky, for standing, and we thank you for acknowledging and recognizing that this really is cross-cutting work. I'd like to do two things tonight for my update. One, I want you to take, commissioners, if you will, look in your packets, the approval of minutes, and the second is to present to the commissioners as well as to the public a revised budget. So first, just for context, as a commission, we've been very thorough in capturing and documenting our portion of the movement that's happening in the region. So we do have lots of background information. In addition to, behind me is a court reporter who does a very diligent job in making sure that we have a record that's put out to the public. What we also need to do is to add a record of minutes. The purpose is for this to document commissioner attendance for quorum and the action items, each one that has been taken by the commission since inception. So I'm asking tonight for the approval of minutes that have been pulled from our transcripts from December 1st through the April 27th meeting. Yep. Yep. Yes.
The other is, normally we would note, we know that we have these transcribed. Wanted to see, we would normally note the recorder of the minutes. Would there be a universal notation of who the recorders were on the particular minutes, or how we manage that?
Yes, and the recorder can either be the managing director, which would probably be the most consistent thing to do under my supervision. So we'll note the recorder.
I would ask if that would be a friendly amendment to add the name of the managing director as the recorder for all minutes.
Okay. So I need someone, because I'm ex officio, to call the question.
So we've had a motion and a second. Are there any further discussion? With the amendment, all those in favor, please say aye. And opposed? Thank you. I'm sorry, question?
Okay. We'll do that. The request for those that couldn't hear was the name change of TR the way that it's put in the minutes. Okay? So note it with that amendment to make your name reflect the way that you want it to name. Yes. Okay. Second part then, thank you for your input and for that. That will be posted to our website, stlpositivechange.org, is a presentation. I'm going to ask, please, if you'd post the budget on the screen for our audience to view. It's also in your commission packet. This is a revised commission budget that we actually discussed in January, wanting to, as we got more deeply into the work, to make sure that we would adjust these numbers to reflect our reality, and so that time has come. This presentation is based on our current realities, and before I jump into this, I want to ask the co-chairs, either Starsky or Rich, if you want to do overall context prior to me jumping in, or should I jump in? You're good with me jumping in? Yes. Okay, so I will do that. If I direct your attention, please, to the screen or to your proposal. This is a budget prepared in consultation with the United Way, who is our fiscal agent, and with the advisement of the co-chairs. This budget accounts for funds coming from the state of Missouri on the revenue or the income side, and a reduction you'll see of private support by $250,000, which sets our anticipated total now to $1.262 million. Okay? Going to move down to the expense side. So accordingly, I'm proposing for you to take a look at a reduction of expenses. And the overall reduction of expenses total close to $476,000. I'm going to walk you through some major line items so that you see the rationale for the reduction of expenses. First, if you go to the consultant fees and benefits line, this line item, you will see a reduction is due to having loaned executives, which is a good thing to this work. We didn't anticipate that, so we're very happy to have that type of support to undergird the commission's work. And a second reason for this reduction is the timing of onboarding consultant resources. Originally, we had projected to have full staffing in February. We were able to procure these resources, but the onboarding process happened the first week of May. And so those are the two reasons you will see that reduction. If you go down, there's three other areas of reduction to explain. It's audit, legal fees, and website maintenance. These particular line item areas are services that we're receiving at either a greatly reduced fee or provided to us pro bono. And so I just wanted to note that as well for the record. Now, I will note that the majority of expenses, if you go to the working group meetings line item, have been provided in kind to the commission primarily because of the University of Missouri St. Louis. They have allowed us to be and host those meetings, those spaces, the audio-visual, the water service, all of that has been provided to us primarily in kind, which allows us to reduce our expenses by $91,000 in the working group line item. So we're thankful for UMSL for that. And then the last part of the reduction explanation, if you look at the line item reduction of racial reconciliation resources and the commission research reports, those two have significant numbers originally budgeted, and they have been greatly reduced or eliminated due to the impact of the procurement guidelines, which are very thorough, and they take significant time to navigate. So this has impacted our ability to onboard these resources that originally we would have provided immersion experiences both for our commissioners as well as our community. And this has limited our ability as well to produce these research reports as anticipated because we have a very aggressive timeline with which to work. So here's what we've learned. We've learned to work smarter, we've learned to work harder, leaner, and longer for this amount of time. And we do so actually very, very happily because this really is a labor of love. Next, the single line item that I'm proposing to increase, so there's only one increase in this budget, is in the community engagement and commission meeting line item. It's really the core of what we do and how we are delivering this work. And this line item is increased by $32,000. This accounts for expenses that we anticipate will be incurred for bringing in national experts to upcoming commission meetings. We've been in conversation with Cincinnati, for example. We have submitted a grant to Robert Wood Johnson Foundation to help us to pull in those national resources so that our recommendations are informed by national models. Therefore, if you look at the punchline, our total expenses will be reduced from the original projection from $1.36 million to $884,319. Okay? So with this expense reduction, you'll see a projected $377,000 available for implementation and translation work to support commission recommendations. This is funding that we are saying that we would like to target toward implementation post the September 15th report. So we have a placeholder for that. There's more discussion to be had. There's lots of detail that will need to be guided. But it's overall a very good thing to be very judicious about our expenses. Now in our 6th month of work, this is a budget that more accurately reflects our current financial reality. It does allow us to provide increased transparency to commissioners and to the public to go ahead and to change these numbers to our current state. And at this time, I'm going to open up the floor both to the co-chairs and to the commissioners to ask additional questions as well.
I might just make a brief introductory comment, and Starsky will pick up things that I miss. First of all, in terms of process, as we've talked about this here, and Starsky and I just talked through this, Bethany and her team have done an extraordinary job with the United Way. Danielle Wallace, who is here or was here, and the fiscal team of the United Way have provided excellent support in a very complex circumstance, navigating through and making sure we do all the state procurement rules and follow all those processes, in addition to following all the requirements of the grants that have been made to us, is important to do and do right, and they are working hard to do that, and that's why these changes are coming to us at this time, because we make sure that all those things have been done properly. Secondly, the reduction in revenue to the 1.262 million level and the reduction in expenses down to the 884,000 level are significant changes. And so because we want you all to have an opportunity to fully understand those changes, and we want the public to understand those changes and the community to have a chance to look at this, is or will be posted on the website. We won't ask for final approval tonight. We'll give you a chance to look through it. Again, Starsky and I reviewed this thoroughly with Bethany last week. You all saw it on Friday in your pre-packet, but we think it'd be better to give some time for everyone to look through it. If you have individual questions, we can pose them tonight or pose them to Bethany and her team through the week. And then what I might do, Starsky, if you wouldn't mind, comment on the translation and the implementation portion a bit so that we get kind of clear our thought process there.
So if you would recall, one of the things that we've been intentional about already is to say that we know that our desire and our commitment is to submit a report to the community and to the governor by September 15th, but we recognize from our early conversations with other communities that some leave behind for monitoring and evaluation will be required, and we know that we have budgeted even out to have some operations winding down through December 31. So what we want to give care to do is to be able to seed in the community some institutional strategy, commitment, or identify a location that would be resourced to help to monitor the recommendations of the commission beyond. And so this that is left as net provides us an opportunity to provide for that. We're also giving careful attention to which resources can be used to transition for those purposes. So we're identifying very closely and looking at those that will be available. Some of these funds come on a reimbursement basis. Other ones are available for general operations. And we've also been blessed to work with the United Way on some opportunities for NAP credits and the like that could be leveraged for implementation as well. So we just want to make sure that this is not just, kind of extra dollars out there, but they're on point and on purpose. We've already begun some discussions with small groups and leaders in the community who have helped us to begin to think about implementation and translation strategy. And you all, of course, will be pulled into that dialogue in coming weeks as you received some schedule of those early meetings. So this is just wanting to make sure we have a mechanism by which we can build upon the successes of the policy recommendations that are discussed here. Any other questions from commissioners about the budget now? Again, as Rich noted, we can also get those later because we won't act on it tonight.
Just one quick question, Bethany. I know the commission has received quite a large amount of in-kind contributions. I'm just wondering where that's reflected in the budget.
What we do is just to make revenue and expenses very clear, we removed it from this revised budget. But when we do the accountability on the monthly status, we do ask for that information from United Way, and it is included. Just so that we're clear on what the dollar amount is, we're approaching $350,000 toward in-kind. When we inserted that cost, it seemed to balloon it a bit and wasn't as accurate as what we presented tonight.
Thank you. Great question. Any other burning questions for tonight regarding the budget? Good deal. Then we do extend again and add our thanks, as Rich has noted, to the staff team and Bethany for your leadership, for your hard work in days that are long and times that are lean, and doing it with a smile and joy and great support providing to each and every one of us. As we prepare to close out on tonight, just want to quickly announce our next meeting will be Monday, June 8th. See stlpositivechange.org for meeting location and details. We are slated to be in St. Charles High School, 725 North Kings Highway in St. Charles, Missouri. 6331. We note, of course, this is a regional conversation. This is a regional reality. We encourage you to be helpful to us, if you would, in sharing with our neighbors and friends in St. Charles, or planning ahead a little bit to make the trip. If you are part of that 41% that was on the thing tonight from St. Louis, or the 43% from St. Louis County, we invite you to plan ahead a little bit to be with us. I want to invite you, as we prepare to close out on tonight, to stand. We'll close out. We invite you always to stand as we close, but we're going to do something just a little bit differently on tonight. We close a little bit in solemnity, in silence. I want to invite us tonight to close in celebration. So with another opportunity to embarrass our co-chair, we're going to invite him to come to the center. We'll invite Becky James Hatter, our co-chair for Education and Child Wellbeing, to come to the center. And I want to invite you to join me tonight. Matter of fact, you might want to drown me out in singing happy birthday to our commissioners yeah, there's birthday cake in the back, so you got to sing and you got to take birthday cake. And so with all business being closed and officially adjourning at this time, I invite you to join me in singing happy birthday to our dear commissioners here. Happy birthday to you. Happy birthday to you. Happy birthday, dear friend. Happy birthday to you. Yeah. Thank you all for coming. Grab cake and enjoy.